Proms is moving across healthcare. From orthopaedics to mental health, this innovative system can be customised to suit your patients. The annual Proms Summit has been organised to create a network of people who will shape the future of Proms. We want to share knowledge, improve our understanding of patient-reported outcome and experience for different interventions, and in the process create an action learning community to acquire knowledge through actions and practice.
The good thing about Proms is that it's a very simple tool that patients can understand, they can contribute to, and we as clinicians find it relevant. I'm sure the commissioners, who will actually eventually be the ones responsible for designing the service or funding it, will also understand the tool.
The event's been excellent. I think there's a good cross-section of academics, clinicians, and I think that's always healthy when you have both. So the event's been very informative. It's been excellent.
The Proms programme is there for the benefit of the patients, for the clinicians that are actually using the measures as well, and obviously that will then benefit the commissioners and the government.
The event's been really useful. It's stimulated a lot of really good discussions about Proms and trying to get it higher on the agenda.
Excellent, yes, very thought-provoking, plenty of food for thought to take back home and implementing our Proms programme back there.
We're already using it for quite a lot of the follow-up. In fact, in our health area, we've got GPs who are doing the follow-up appointments now with Proms questionnaire and X-ray rather than bringing them back to the hospital at all.
Thank you for being here. I mean, I still can't believe the excitement that we've managed to generate. There's an excellent faculty. Hopefully everything that is known about Proms today is in this room, and use it, please.
So what is the National Proms Programme? It's not actually just the elective surgery, which I'll talk more about in a moment.
This is the descriptive system. On 5 areas, patients are asked to report themselves as having no problems, some problems or extreme problems.
Because if you're in this red zone, your costs are higher than average and your patients have poorer outcomes than elsewhere. So we're going to see which hospitals fall into that red zone, because those are the ones that probably need to take some sort of action. Instead, you want to be down here.
Some examples of how taking the Oxford hits for this kind of way.
I'm hoping that this new commissioning world is going to be a new world of outcomes.
So I see a very powerful role, therefore, for Proms as being at the centre of the suite of metrics by which we know whether or not we are delivering quality.
In 30 years' time, consumers of healthcare, and indeed people responsible for their own health, will be radically different to the way in which we are now, because they will have more data accessible to them.
I would say to commissioners quite strongly, do not start saying, we'll only do a hip replacement if the score is X. There's another very simple reason. Although these scores are
I found it extremely enlightening, and it fits in with my ethos of involving patients.
Well, ultimately I think the patient will benefit, but not only the patient, the clinicians benefit in that they will also get their own satisfaction as to seeing how their results also perform.
The main benefit of the Proms programme from my perspective is involving patients within their care and the whole shared decision-making agenda.
The ability of a patient to understand what's driving their level of quality of life and perhaps work with the clinician and wider clinical teams to take ownership of what it is that's holding them back in terms of optimising their quality of life from the treatment they receive. I think that's got to be the principal beneficiary.
As the first time that this conference has been run, it's been a really good way to get everybody together that's working in the Proms circuit at the moment. It's been a great opportunity to network and really useful and informative day.